Hello and welcome to Functional Medicine Insights, biomarker testing for MS and neuroimmune disorders. My name is Adair Anderson. I'm the product marketing educator here at Vibrant and just wanted to go over some housekeeping items before we get started. All attendees are in listen only mode. If you have questions during the presentation, please submit them as a comment. We will have time at the end for Q&A. This webinar is being recorded, so you'll get a copy of the recording and the slides after the webinar ends. And now I am pleased to introduce you to Dr. Terry Wahls. Dr. Terry Wahls is an for Functional Medicine certified practitioner and conducts clinical research using functional medicine principles in the setting of multiple sclerosis. She's published over 100 peer-reviewed scientific publications, abstracts, and posters related to multiple sclerosis, autoimmunity, and chronic diseases. In 2018, she was awarded the Institute for Functional Medicine's Linus Pauling Award for her contributions in research, clinical care, and patient advocacy. Dr. Has secondary progressive multiple sclerosis, which confined her to a tilt-recline wheelchair for 4 years. Dr. Wahls restored her health using a diet and lifestyle program she designed specifically for her brain and now pedals her bike to work each day. She's the author of the Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using paleo principles, and also the cookbook, The Wahls Protocol Cooking for Life, the revolutionary modern paleo plan to treat all chronic autoimmune conditions. You can learn more about her clinical trials at terrywahls.com/trials. Take it away, Dr. Wahls.
Okay, welcome, and let's get going. So here are my disclosures. I've completed grant funding for the National MS Society. I've published several books. I have several trademarks. I have financial relationships with Penguin and Vibrant, and I have equity in all of those companies. I own the website, terrywahls.com. Now, when we look at the causes of myelin damage, I'm sure all of you know, there's a very deep connection between a microbiome, our brain, and our immune health. And when we look at myelin, if we have an unhealthy diet, unhealthy lifestyle, we're more likely to have nutritional insufficiencies and dysbiosis. And this dysbiosis will occur in every part of our body. Dysbiosis in the skin, in the eyes, in the lungs, in the mouth, in the small intestine, large intestine, in the vulva. And we will have systemic inflammation. We're more likely to have increased leakiness of the gut, and that leads to increased leakiness of the blood-brain barrier, more inflammation in the brain, and more microglial reactivity, which will lead to more new enhancing lesions, more relapses, and over time, more progressive disability for people with multiple sclerosis and for people with other systemic autoimmune diseases that lead to neurologic and psychiatric complaints. And then if we have a higher level of toxins, we'll have more inflammation and more mitochondrial strain. And if you have more mitochondrial strain, you don't make enough ATP. That will lead to more degeneration in the brain, more atrophy of the brain, more atrophy of the spinal cord, and more progressive disability. If we have inadequate hormone levels, and that can be thyroid hormones, that can be sex hormones, those are trophic factors for the brain, and that will lead to degeneration in the brain, more atrophy, and more disability. And then as we age, particularly over the age of 40, we again will have more degeneration and atrophy and more progressive disability. And this is why a disability will occur, that people go from acute waxing and waning for their multiple sclerosis and other systemic autoimmune diseases, and it converts to less relapsing, remitting, and more of the slow progressive phase over the age of 45. And there are 300 categories of brain cells that have been identified. But if we take a really simplistic, we can look at the ependymal cells that make spinal fluid, astrocytes that wrap the capillaries and bring oxygen and nutrients to the rest of the brain. The neurons, those are the brain cells, the oligodendrocytes that wrap around the axons to make the myelin. They're called Schwann cells in the periphery. Then we have the microglia that are the resident immune cells. And we have greater recognition that it's the lifestyle factors, that is the quality of our nutrition, the balance of our microbiome, the balance of physical activity, the stress, and it has to do with early life stress, adverse child experiences, adult stress, the quality of our sleep, and our circadian rhythm that will have a major influence on the microglia. And if we look at our human ancestors, now we could go all the way back 4 billion years when life first began, to 200 million years when mammals first really emerged, to 6 million years when humans separate from other primates, to 2.5 million years when we're the genus Homo, or 250,000 years when we are the species Homo sapiens. And we know that our DNA, through random mutations, has evolved very slowly over those 4 billion years that life has been here on Earth, or millions of years since we've been the genus. But our environment has radically changed over the last 10,000 years. We are eating radically different foods. We're eating far more sugar and white flour processed foods. We have many more synthetic chemicals that we're exposed to every day. We are no longer out in the sunlight 24/7, 365 days. And we no longer are moving every day. In fact, we are spending hours sitting every day. And the environment does not match the environment that we evolved in over hundreds of millions of years. Now, the environment, again, our nutrition is very different, our gut health is very different, our toxic exposure is very different, and our hormone balance is now very, very different. And so in my clinical practice, I do a health timeline, and I look at preconception to the present. I have time. I like to understand the parents and the grandparents, the details of the birth, the early life stress, the physical and psychological stress as an adult, the antibiotic exposure, particularly in the first 3 years of life. Their modifiable lifestyle factors, nutrition, movement, stress, sleep, their toxin exposures, exposures to water damaged buildings, and their current gut symptoms, nausea, vomiting, diarrhea, constipation, bloating. Now, we know in the 5 to 15 years prior to MS diagnosis, people, and this is true for other systemic autoimmune disease, they're more likely to have exercise-induced asthma, migraines, headaches, really severe painful periods, heavy bleeding, depression, anxiety, a variety of skin problems, rashes, blisters, eczema, poorly controlled pain from a variety of locations that may be considered tendinitis, endometriosis, again, that pelvic pain, and difficulty getting pregnant. And again, when I think of autoimmunity, there's a genetic vulnerability of 200 to 300 genes that increase the risk ever so slightly. The vast majority of time, the vast majority of folks with those genes do not get MS or the autoimmunity. Step 2 is the infection. And with our 16 microbes that increase the risk for infection, for developing autoimmunity and MS, but the vast majority will never get MS. Then there are these other environmental factors. So the conventional docs will say, well, we don't know, so just take the DMTs. The functional medicine folks, we're going to address those environmental factors. We're going to think about nutrition, think about food sensitivities, One, to investigate the dysbiosis, whether or not people are digesting. Think about their early life stress, their adverse childhood experiences, their adult physical, psychological stress, their toxin exposures. We want to know their hormone balance, their circadian rhythm, and the quality of their sleep. And then we've all been through COVID-19. Here in the US, 80% of us have had COVID-19, many of us multiple times. 2% have persisting symptoms at 12 months. 2 to 4 million have had long COVID, more formally known as post-acute sequela of COVID-19. If you have MS, you may have what's called a pseudo-relapse, so a worsening of MS symptoms attributed to the COVID-19, which may take many months from which to recover. And if you don't have MS, we know that you are having continued activation of the innate immune system and an increased risk for new additional autoimmune diagnoses and new diagnoses of MS. And if you have comorbid diagnoses, it will accelerate the risk of MS in a sooner time to job loss, sooner time to gait impairment. So symptoms of anxiety or depression, or a formal diagnosis of anxiety or depression, you have a much more aggressive disease course. And then if you have obesity, high blood pressure, high cholesterol, heart disease, again, that's a more aggressive disease course for MS. And as you see, many, many, many of our patients have obesity and high blood pressure. And metabolic syndrome, insulin resistance, prediabetes, diabetes, all will accelerate comorbid or MS. And the conventional neurologist is not thinking about metabolic syndrome, insulin resistance, prediabetes, and they're not looking for it. So when I teach the neurologist, I tell them, send people to primary care to address the modifiable lifestyle factors. Send them to a mental health professional to talk about the early life stresses, the adverse childhood experiences. Talk therapy, trauma specialists can be very, very helpful for this. And do they know how to cook? 37% of Americans are eating fast food on a given day. And the younger you are, the more likely they are to be eating fast food, and that they do not know how to shop. They do not know how to meal plan. They do not know how to cook using a recipe. Now, nutrients drive the biochemistry and physiology of life. The reality is many of our patients are living in food deserts. I live here in rural Iowa, and we know that many of our smaller communities no longer have a grocery store. And so they may be limited to shopping at a convenience store, gas station. They may not have access to a kitchen. As already mentioned, they may or may not know how to cook. They may be relying on processed and ultra-processed foods. Now, if they're taking supplements can create imbalances. If you're overweight, you're more likely to have multiple nutrient insufficiencies. And if you're overweight or you have chronic disease, you have higher nutrient requirements in order to haul away and remove the improperly made proteins, replace them with correctly made proteins. If there's mental health issues, there's higher rates of inadequate nutrient intake for omega-3 fatty acids, the B vitamins, tryptophan, which is an amino acid, the minerals chromium, iodine, iron, lithium, selenium, and zinc. And you may not know that 7-Up used to have lithium added to it. Coca-Cola used to have cocaine added to it. Our mental health folks more likely to have excessive added sugar intake, excessive white flour intake, excessive intake of these ultra-processed foods, and they're far more likely to have food insecurity. Now, if we look at multiple sclerosis patients, they have a more limited diet. There's a lower intake of 31 nutrients compared to non-MS controls. The estimated average requirement is the nutritional requirement for half the population to meet their requirements. So they are likely to be insufficient for zinc and iron, the B vitamins. The total antioxidant capacity, that's lower polyphenol, so that's really less, far fewer fruits and vegetables. And the people with more severe disease will have worse nutritional status. So it's a reminder to look for metabolic syndrome. So if you measure the abdominal circumference, the blood pressure, look at the fasting lipids and the glucose. You 3 out of 5 elevated blood pressure greater than 130/80, a abdominal circumference of 35 inches in women, 40 inches in men. That's 90 and 100 centimeters. Triglycerides greater than 150. HDL less than 40 for men, less than 50 for women, and the glucose greater than 100. And if you have two, you certainly have a metabolic health issues that could be improved. So it's an indirect measure of insulin. If people don't have their insulin measured, I tell my followers you could, most often they have fasting lipids. They could check a triglyceride, HDL ratio. Greater than 4, definitely insulin resistance. Less than 3 is healthy, but less than 2 is ideal. Or you could look at the A1C. The formal diabetes is greater than 6.5. Prediabetes is 5.7 to 6.5. Healthy, less than 5.4. Ideal, less than 5.2. The fasting insulin for diabetes is greater than 25. For insulin, the ideal is less than 8. Now, if you look at life's inputs, when we look at nutrient levels, if it's severely low, deficient, then you're going to have a disease state. If it's severely high, you're toxic. And there's this broad category where things are optimal. Then there's sort of a yellow category where you are sufficient, but it's not in the optimal. And every nutrient can become toxic. So you think of water. If we don't have enough water, we're in renal failure. If we have too much water, you have water intoxication, and you can have strokes as a result of water intoxication. When you do a nutritional exam, look at rapidly turning over tissues. I look at problems with sensory, pain, hair, taste, smell, skin, and nails. Tremendous clues there. I'll just go over a few of these. So if you look at scalp, when there's flaky skin, dandruff, I think of yeast overgrowth, imbalance of omega-3, omega-6 fats, zinc, copper, folate, B12, and I'm thinking of blood sugar metabolism with glucose, A1C, and insulin. For taste, and I think about taste and smell. If there's an abnormal taste and smell, that can be a warning sign of early dementia. Do they have a traumatic brain injury? Do they also have a peripheral neuropathy? And remember, many medications can impact smell and taste. So you can use the physician's desk reference to see if that's a listed side effect for that prescription medication. And you can look at the tongue. Is there white coating of the tongue? Now I'm thinking of yeast, looking at glucose, A1C, insulin. A black tongue can be yeast overgrowth as well. So I'm looking at the same values. Geographic tongue, I'm looking at zinc, iron, and pyridoxine, folate, and cobalamin. So be 6, 9, and 12. Burning mouth and dry mouth, angular cheilitis, rash at the corners of the mouth. So for these things, I'm thinking of the B vitamin levels. So I think thiamine, riboflavin, niacin, pyridoxine, folate, and B12. I think about the zinc copper ratio and the toxic neuropathies. lead, cadmium, arsenic, and mercury. Now, acne, our hunter-gatherer societies really do not get this. You can think about vitamin A toxicity. There are many folks in the carnivore world that are advocating for consuming a pound of liver every day. So I ask how much liver people are eating. Bromine toxicity can lead to bromine being excreted through the skin, looking like an acneiform rash. Insulin resistance can look like this as well. So I'm looking for glucose, hemoglobin A1C, insulin. There's not a good way to measure vitamin A levels. It's a fat soluble vitamin. So you're going to have to think historically. The omega 3, omega 6 fatty acid ratio can be helpful. And look at urinary bromine. Now, for the skin, there's a condition called follicular hyperkeratosis, chicken skin on the arms. There are a lot of SNPs that influence how well we can utilize plant-based carotenoids, and 25% can't make vitamin A very well from beta carotene. So think about insufficiencies of vitamin A, vitamin K, the zinc copper balance, the omega 3 6 balance. Nails, white lines, white spots. I'm thinking of zinc, copper, arsenic, and selenium. And here's an example of some thick white lines on the nails. So the basic labs that people do, CBC, liver enzymes, including albumin, will look at the renal function, fasting lipids, glucose, vitamin D, highly sensitive CRP, a hemoglobin A1C, homocysteine, B12, folate. Ideally, also get an insulin. And then based on the physical nutrition exam, I might add folate, cobalamin, thiamine, riboflavin, niacin, pyridoxine, fatty acids, zinc, copper, selenium, lead, mercury, arsenic, and cadmium. Now, remember, toxins interfere with physiology. They're going to increase the risk and severity of autoimmunity. Low estrogen, low testosterone will accelerate disability. Cortisol disruption of the circadian rhythm, abnormal timing of cortisol disrupts sleep. Now, we can get additional testing through Vibrant Wellness that use urine, saliva. You could send blood phlebotomy, or you can do at home finger prick with blood spot and a stool test. You can get a micronutrients profile, and you could get send them to the lab for serum testing, or you prick the finger and get a microtube. You don't have to fast. The serum amino acid as a result of recent dietary protein. Intracellular will be stable. And whether you get fasting or non-fasting at the recommendation of the ordering physician. It's a 13-page report. You're going to get serum intracellular values, what it does in the body, how it gets depleted, some clinical manifestations, food sources for those nutrients, and supplement options. And again, medication supplement restriction is not needed. You're going to get fatty acids profile, look at DHA, EPA, arachidonic acid, the omega-3 index. You'll get some key amino acids and the minerals calcium, magnesium, chromium, zinc, copper, and manganese. The antioxidants, coenzyme Q, cysteine, glutathione, and selenium. The B vitamins plus vitamin C, E, vitamin D, K2, and retinol, the fully formed vitamin A. Here's some examples. And you'll see that you have a red zone, a orange zone, and a green zone for the nutrients, and some big categories: bone health, heart health, gut health, liver detox, mitochondrial, and neurologic cognitive function. And you're going to get these big categories, some looks at the CBC, the fatty acid profile in terms of the levels of each of these big categories of fatty acids, the ratios, are they optimal, or are they in the toxic, insufficient, or uh, suboptimal range? Then again, you'll have some key amino acids that you can look at. The vitamin levels, the B vitamins, you'll have ascorbic acid, and vitamin K and K2, and the uh, 25 hydroxy and vitamin D3. Now, the micronutrients pairs really well with food sensitivity, gut zoomer, wheat zoomer, total toxic burden, and salivary hormones. So again, the food sensitivity can be a sign of a leaky gut, poor digestion. The gut zoomer is going to look at the microbiome, inflammation, and digestion. The wheat zoomer is going to look at leaky gut, celiac disease, and some gluten and wheat sensitivities. Total toxin burden will look at the variety of toxins, and salivary hormones will give you a chance to look at cortisol and the sex hormones. Okay, so if there's unrecognized food sensitivity, you can start with a basic elimination diet. Take out gluten, dairy, and eggs. And those are the three most common um, uh, foods causing an immune reaction. The next step would be to take out nightshades, nuts, seeds, grains, and legumes. The next step is citrus and fruit sensitivities. And that's what we had to do with the VA when I could not order any of these more sophisticated diagnostic tests. Or you can check food sensitivities and have a much more precise food recommendation. Now you get a 56-page report when you're doing the complete. You can do this via a blood collection phlebotomy or dried blood spot. And it's based on a bunch of IgG categories. Or you could get a food sensitivity for 96 foods, or food sensitivity for 84 foods, or the complete, which is for 200 foods. And again, what you're going to see is a reference range. So the screen, it's fine. You can have those foods. Red, high risk, you should take those foods entirely out. In the moderate, I take those foods out for 3 to 6 months and then reintroduce them. And again, so you're going to have a report that will tell you the foods to remove, the foods to remove temporarily, and then bring back on a every 4-day rotation. Okay, Hippocrates, I think we all know him. He's been around for thousands of years. He made the observation that all disease begins in the gut. We have to be able to eat our food, digest it, and then absorb that food. And for people with MS, constipation often precedes the MS diagnosis. And for autoimmune bowel disease, constipation can precede the diagnosis. And you can have constipation in the setting of parasites and also the setting of some dysbioses. And chronic diarrhea is rare for people with MS. It's common for people with autoimmune bowel disease, and you may see it with a wide variety of parasites. However, parasites can also be protective. There are interesting studies done. Keep in mind that over the hundreds of millions of years that mammals have evolved, we've had parasites, protozoa, and worms in our gut that whole time. And we've had bacteria and viruses and fungi in our gut that whole time. There are research studies done in China and in India that treated children for their parasites, their protozoa, and their worms, and followed them. And they found that the outcomes was no different between the kids who had been treated for their parasites And so they stopped. And we know that there are animal models that have used parasites to successfully treat people with inflammatory bowel disease, rheumatoid arthritis, asthma, and multiple sclerosis. And there's an interesting study in case series in Argentina that treated by a neurologist, where worms are fairly common. Patients with MS developed worms. Their disease activity was remarkably reduced. So the neurologist is happy, the patient's very happy. The patients begin to have more symptoms from their worms. They get treated, the worms are gone, and the MS activity increases. So parasites may be a problem. Parasites may also be protective. The Gut Zoomer is a 16 page report. They give information on diversity, commensals, those are the helpful bacteria, the probiotic bacteria. The pathogens, these are the bacteria and the viral causes of diarrhea. Markers of inflammation, digestion and malabsorption markers, bile acid markers, antibiotic resistance genes, and occult blood. They'll also talk about um, gut bacteria, protozoa, and helminths that are associated with increased risk of autoimmunity. And again, you're going to see a ratios that are in the red, caution, orange, and optimal green. And you'll see ratios of the Firmicutes to Bacteroidetes, the Proboscis to Bacteroidetes. Do we have commensals that support neurologic health, leaky gut, metabolic health, liver health, hormone balance? Are you at risk of small intestinal bacterial overgrowth? And then there's going to be a long list, and you'll have a list of the helpful bacteria that are detected or not detected. And the probiotic bacteria that are helpful, detected or not detected. And then we start going through the pathogens that increase the risk of acute diarrhea. So you see Clostridium, Campylobacter, Shigella. And then we have the protozoa, that these are the single cell organisms that increase the risk of chronic diarrhea and can increase the risk of a autoimmune process. Blastocystis, for example, increasing the risk of a autoimmune response. Giardia, increasing the risk of autoimmune response. And again, then we have worms that increase the risk of a autoimmune response. And we have the viruses that are associated with a acute diarrhea. And then here we have some fungi that are associated with a higher risk of dysbiosis and candida overgrowth. You see the Candida albicans and the Candida species. And you'll see that we also have antibiotic resistance genes for Helicobacters, for the cruthomycin, the fluoroquinolones, and antibiotic resistance to beta lactams and the macrolides. And then we have inflammation markers that can be very helpful if you're wondering about the development of a inflammatory bowel disease. uh, and enzymes, the pancreatic elastase. Is there evidence for fat malabsorption? What's going on with the phospholipids? You'll also have access to bile acid metabolites as well. And again, keep in mind, you're going to have things in the green, orange, and red category. Now, the wheat zoomer, again, you can send people for a phlebotomy or a dried blood spot. It's an 8-page report. You also will get zonulin, which is a blood biomarker that will tell you are they at risk for a leaky gut. And you'll see, in addition to gluten, are there wheat proteins to which the person is reacting? So they may not have celiac disease, but they may have non-gluten sensitivity. Again, gluten and gliadin is very sensitive for celiac disease, but there are additional wheat proteins, dozens of them, that may cause an abnormal immune response. And so you're going to have a score for leaky gut. You'll see if you're having antibody to zonulin, if you're reacting to lipopolysaccharides. And then we're going to have a bunch of gluten and gliadin panels, and then a bunch of wheat protein panels as well. Now, the total toxin burden, I think, is really quite helpful because we live in such a toxic world. You're going to have, this is a 24-hour urine. You'll see high, moderate, low, possible sources for that compound, the associated risks with the compound that's been elevated. There are 20 heavy metals that are looked at. Then there are mycotoxins and other environmental toxins, plastics, and solvents that are examined. Now, you can do a pre and post provocation. However, you never want to do a provocation for a woman who is pregnant, lactating, or is sexually active without reliable contraception. And if you could do a provocation with EDTA, DMSA, or DMPS, or you could use salt plus iodine and iodine. But again, you never want to do a provocation for pregnant, lactating, or a woman who's not using reliable contraception and is having sexual activity. And that's because you would be dumping all that toxin into the developing embryo. So the ochratoxin, that's one of many mycotoxins, and so they'll give you a bunch of sources and some detox strategies for that. And there again are a slew of mycotoxins that you can look for using the Total Tox. And then this is a list of the heavy metals. Again, you'll have red, yellow, green, and they will give you a list of potential sources. Now you'll see that most of your patients will be high on gadolinium because gadolinium is the contrast, and they may be extraordinarily high on gadolinium if they're getting regular MRIs. Glyphosate, I live here in Iowa. Glyphosate is in our rainwater, unfortunately. And so if people are eating conventional foods, they're going to have lots of glyphosate. And then we have a variety of environmental exposures, herbicides, some of the forever chemicals. Triclosan is in the hand sanitizer as well. Atrazine is in the groundwater in much of Iowa. Now, salivary hormones, this is a 5-page report. In here, you're going to get cortisol, estrogen, estrone, estradiol, estriol, progesterone, testosterone, and the precursor DHEA. You will not get thyroid hormones from this. You'd have to get the thyroid hormones separately. And the cortisol is at 4 time points, 8 a.m., noon, 4 p.m., and 8 p.m. If they have dry mouth, this will not work out very well because people will struggle to make enough saliva. And you'll see here, hopefully you guys can see that there's a fairly faint green zone there that shows you the optimal increase in cortisol and cortisone occurring in the morning. That comes down in the afternoon, down further in the evening and night. So it's not uncommon that people may have elevated cortisols or cortisol that, if it's elevated for enough years, again, becomes low throughout the day, or the timing may be inappropriate, leading to difficulty with sleep. Then you'll also get the estrogen, the progesterone, estrogen ratio, testosterone, and DHEA, and it's sex specific, and again, you'll have red and green zones as well. Now, there are red flag symptoms to refer them back to primary care for workup. If they have unintended weight loss, remember the DMTs increase the risk for secondary cancers. If they have worsening pain, bleeding, black or maroon stools, I have to send them in for GI workup. If they have persisting diarrhea, worsening constipation, I want to send them to a GI doc for workup. Diarrhea alternated with constipation, I will send them to a GI doc. You want to keep them involved with their primary care to manage their chronic disease. As you improve their health, if they're on any prescription meds, the doses will change. So medication needs will change for high blood pressure, blood sugar, anxiety, depression. If their mood improves, you want to reduce their psych meds so they don't become manic. And again, if their pain reduces, you'll want to reduce their pain meds. Never abruptly stop medications, including DMTs. They'll have a severe rebound. I prefer that people have a great response to diet and lifestyle, preferably for 2 years before I transition from their current DMT to a less potent DMT with fewer side effects. And you want to work with their prescribing physician so that they're happy to send you more patients who are open and wanting to have support to address their environmental and their modifiable lifestyle factors. I am recruiting for people with autoimmune, neurologic, and chronic health conditions. We have a patient registry. So please send your patients to terrywahls.com/trials. We have interventional studies for fibromyalgia and post-acute sequela of COVID. So send your folks to terrywahls.com/trials. They do have to be in the United States, however. So it's a great comprehensive assessment. You could do a careful history, get the micronutrients, food sensitivity, gut zoomer, wheat zoomer, total tox burden, salivary hormones. Collaborate with your primary care and specialist. Don't abruptly stop prescription meds. I have an online practitioner training program where I go over my approach to MS and autoimmunity. Specifically, I teach people the Wahls behavior change, where we are able to get people to have a 95% success rate at adopting, sustaining a better diet and self-care routine over a year period. We teach evolutionary biology, I go over MS research updates and more. There's a monthly Q&A with me. You could use the code reinventwalls for a $1,000 discount for the certification program, but you have to sign up before February 1. If you have any questions, reach out to certification@terrywalls.com. And I believe that is my last slide. I don't know how to stop my slides, Adair, so I'm figuring you know how to do that. Okay, great. Thank you.
Gotcha.
And I wrapped up at the right time.
You sure did. Right on the dot. Thank you for that phenomenal presentation. I really like how you started with just the basis for what contributes to MS and neuroinflammation. So basically, the more inflammation you have, the worse it's going to be. So how can we address the inflammation? Looking at toxin, looking at food sensitivities, making sure they don't have micronutrient deficiencies. Thank you so much for that. Let's see if there are any questions for you from the audience.
I want to point out to people that um, changing what we eat is a really hard thing to do. That 20 less than 25% of folks will change their diet based on when their medical team says, change your diet for these reasons. And then at 2 years, only 2.5% are still changing their diet. So one of the things that we've been very successful is teaching people using the Wahls behavior change model to successfully change their diet, add exercise, improve their sleep, take the supplements we recommend. And that is a big challenge for all of us.
Indeed, any practitioner knows this.
Yes.
All right, first question was way back at the 10 minutes after the hour. What are the 16 microbes and the environmental factors? And you may have covered some.
Yeah. So, the most common microbe that people are going to hear about is there was a big paper that came out from the military that said it's Epstein-Barr virus. They measured the antibodies to Epstein-Barr, and that development of the antibodies to Epstein-Barr dramatically increased in people with MS. However, the vast majority of folks who have Epstein-Barr never develop MS. 96% who develop Epstein-Barr will never get MS. Never, never. And then we have the coronavirus, streptococcus, staphylococcus, campylobacter, Lyme, and then I don't remember the sequence after that. Nearly all of us have been exposed to at least one of those 16 viruses. Nearly all of us in those bacteria. And so nearly everybody has had one of those infections. You might have one or more of those genes that put you at risk. Then it's all those other environmental factors that I went over for you. So from a functional medicine standpoint, assume that they were infected. We all are. If they have an autoimmune disease, they probably have one or more of those genes. Like, okay, so we got that. Then we have to play in what we all have, which is we're going to help them optimize their modifiable lifestyle factors at a pace that they and their family can manage. Now, because I retired from the VA, one of the best things I was able to do is just really wonderful. I can indulge most days on 2 hours of self-care in the morning where I meditate, I exercise, I do my sauna, I go out, and now, today I sat out in minus 24 degrees wind chill for a while for my Wim Hof, and then took my cold shower and went on with my day. Now, your patients aren't going to spend 2 hours on their self-care routine until they retire. Then maybe they can. So the emphasis is make these changes at a pace that they can manage, incorporate this self-care into their daily routine. And maybe it is that they're going to get up every hour and go do a few deep knee bends, have a drink, maybe go to the bathroom. And so they're just going to focus on decreasing their sitting time.
Love those tips. Next question is about the fasting insulin. Dr. K want to know, can you talk more about why less than 2 is ideal?
So that was a misunderstanding. That's it's the triglyceride HDL ratio.
Okay.
So the triglyceride HDL ratio of 4 is consistent with insulin resistance. Less than 3 is healthy. Less than 2 is ideal. A fasting insulin level of 8 or less is ideal.
Thanks for the clarification. All right. Next question, also from Dr. K. I didn't know low hormones accelerated disability. Why is that?
Well, our brain needs plenty of thyroid hormone. We need plenty of estrogen, plenty of testosterone. And at age 40, for men, testosterone levels are steadily falling, and the estrogen levels, fall through the floor once you become menopausal. And thyroid levels begin falling at age 40. It's one of the reasons that strength training is so helpful. It helps you maintain your growth hormone, your testosterone. And it's one of the reasons why many functional medicine docs, and I'll measure sex hormones, and I will send my patients to someone who will do a bioidentical hormone replacement. And I personally take bioidentical hormone replacement.
Great. Thank you for addressing that question. This next one comes from Shelley. And Dr. Walls, do you know anything about vitiligo?
Yeah, it's a autoimmune problem. And we've had people have a lot of success using the concepts I teach in my book and in my courses with vitiligo. It's an autoimmune problem.
Okay. Next one's from Susan B. If someone already has some toxins elevated on their total tox test without provocation, do you ever do a provocation later to assess further toxic burden?
Only if I want to make them sick as hell. Hey, why would you do that? There's no need to do that. You know that they're toxic. So then I would just go ahead and begin to um, uh, detoxify, talk about reducing exposures. I would probably use some binders. And when people take binders in the middle of the day away from their supplements and take it with olive oil, the olive oil will stimulate the release of bile, and then you'll increase your excretion. If you want to make people incredibly sick, give them a provocation.
Loud and clear. Thanks for that clarification. On a related note, do you do a glutathione provocation prior to mycotoxin testing?
I do not.
One question here for me, will there be a replay? We will be sending out the recording and the slides to everyone who registered for this webinar. All right, another question here. Do you think infrared saunas help?
So for people with MS, they typically are heat intolerant. What I tell people is if heat makes your symptoms worse, you need a smaller dose. And so start very slow, very gradually. I use sauna space bulbs, and I tell my patients to start with getting their single bulb. I think it's called a photon. You can keep that as far away as they'll tolerate. As they begin to recover, they can get closer and closer to the bulb. When they feel they can tolerate the one bulb in close proximity, then they can get a 4 bulb unit and start doing a sauna. I also find that as I put people through my program, often we see remarkable reduction in heat or improvement in heat tolerance, and they're able to tolerate saunas. Uh, um, Not everyone, but it saunas are great. They're great for detox, but if the heat increases the symptoms, more fatigue, change in vision, numbness, tingling, they need to not have as much heat.
Gotcha. Makes sense. Case by case basis there. Next question's from Allie. They're curious about the Neural Zoomer Plus for an MS patient. Have you ever used that?
Yes, that is another helpful. It can tell you the other antibodies that are active, and that can be super interesting to see as you are recovering them. Their antibody levels will fall, and so that can be very rewarding to the patient. You can also, but I'm also mindful if you just do the medical symptoms questionnaire and people see their numbers falling. Now, what people want to do is they want to have more mental clarity, less pain, better motor function. And that's more valuable than the numbers on the neural zoomer test.
Gotcha. So subjective and objective data,
Yeah.
both valid.
Yeah.
Next question's from Catherine. What's your opinion of the recent article in JAMA or NEJM that says postmenopausal hormone replacement for 10 years has not been shown to improve brain function? Maybe similar to
So, part of the problem is that they were not using bioidentical hormones. They were talking about Premarin. They were talking about synthetic estrogens and synthetic progesterone. So it's a different compound.
Yep, that's what I heard too. Next one's from Deborah Wolf Baker. I was told using estradiol patch is quote toxic. No testing was involved, but I also use prometrium at bedtime. I've never heard this before. Do you agree?
Well, I don't know why estradiol patch is toxic. So I can't really comment on that. Prometrium, I use progesterone at bedtime. I don't know if prometrium is a brand name for progesterone or if that's a synthetic progestin. If it's a synthetic progestin, it's not as good as natural progesterone, which you can take orally. You can't take estrogens orally that you want to take either through the skin, vaginally, or as a pellet.
Great. Thanks for your clarification on that. And then one final question before we end regarding infrared sauna. Does that mean less heat from a temperature perspective or less time in the sauna?
So,
Um,
so the infrared sauna, it's radiant heat, and you only have to go up to 125. A traditional dry heat sauna takes you up to 200. The key thing is you want to start if you're having your MS patients do a sauna. I prefer using a infrared bulb far away. They make sure you're intentionally small enough dose that there's no symptoms, gradually increase so there's never any symptoms. If you cause symptoms, you created harm.
Thank you for that. Follow-up question. What about cedar saunas?
Well, you can use a cedar sauna and put a sauna space bulb inside that if you would like. Yes. But if you're doing a cedar sauna to 200 degrees, your MS patients will not tolerate that at all.
Gotcha.